Hello and welcome to the Analytical and Diagnostic Techniques introductory session. My name is Emma, and later on in the year when you start your lab sessions, I will be taking some of you for the lab practicals. So for today, I just wanted to do an introductory session on specifically obtaining and handling a range of samples for analysis. So this is one of the learning outcomes for the module overall. So I just wanted to do a bit of an introduction on that. And we're going to focus specifically on samples such as blood samples, urine samples, fecal samples, skin samples and environmental samples. Now for today's session it is purely going to be on how we obtain them and sort of handle them initially. When you come in and actually do the lab practicals, we will then focus on the actual running of those tests. Okay, but today we're just going to talk a little bit about how we actually get them in the first place. So the first thing that we need to think about is, why do we need to take a sample? And this will really vary depending on practice a little bit, and also the role of the vet nurse compared to the vet. So one of the things that a vet nurse may well be involved in is monitoring of husbandry procedures. So this might be environmental samples to make sure that the husbandry procedures and the hygiene procedures, such as the cleaning protocols, are suitable and that they meet the requirements of that practice, especially in sterile areas such as the operating theatre. We need to make sure that we are cleaning it properly in order to avoid some nasty bacteria perhaps, or more bacteria than would normally be expected in that area to be thriving, which in turn could mean that a wound might break down, for example, such as in the case of where we would find Pseudomonas on an operating table, which we want to avoid. We also use the sampling strategies to check the health of a patient for a specific condition. So it might be that it forms part of the diagnostic process for the vet. It is of course the vet who will make the diagnosis, and as veterinary nurses we will support them in that by helping them to obtain samples to test for specific conditions. It might be that we also need to take samples to check the overall health of an animal. It might not always necessarily be for a specific condition. It might be just to check the condition and the health, for example, in a geriatric animal where we maybe are not seeing any clinical signs specifically for anything that might be of concern. It might be that there's an underlying condition that we haven't identified yet, or just to make sure that they are still healthy. So, often a geriatric clinic at a practice will include a regular urine sample, for example. Where we have an animal that is undergoing long-term treatment of a chronic condition, we also need to make sure that we're taking regular diagnostic tests in order to make sure that the treatment isn't causing any serious side effects. So it might be that every 6 months or so. Again, this will vary depending on the practice and on the condition. It might be that they're having routine tests in order to make sure that the condition is still under control with that treatment and that there are no serious consequences of that treatment. So for example, does that treatment have an impact on the kidney function? So therefore, what are the kidneys doing? A blood test can indicate that, or a urine test can indicate that if necessary. And then the treatment can be tweaked depending on the outcome. Of course, that initial diagnosis is probably one of the main things. So of course that is the vet's role, but we as vet nurses are very much involved in ensuring that the diagnostic protocol is followed. We are often the ones that are taking those samples, that are packaging those samples, that are sending the samples off, or that are running the samples. So we are very much involved in that, and we provide that information to the vet in the appropriate format, who can then make the diagnosis. And then we also want to consider the severity of a condition. So it might be that we know that the animal has that condition, a little bit tying, I suppose, in with that monitoring of a treatment, but looking at the severity of a condition, how bad that condition is. So there might be with a fecal sample to look at the parasite load, so how many eggs, for example, are present in a gram of feces, in order to test the severity of that infestation, and then treat it appropriately depending on that outcome. Again, would be the vet's decision. Now, there are a number of ways that we can be involved in the collection of samples, and that will really depend on what it is that we're actually trying to find. So that might be a decision, again, a vet's decision as to whether or not it's going to be invasive or a non-invasive sampling technique, and both are available. You know, if it's a blood sampling technique, for example, it will be invasive, that there is no other way of obtaining that. But it might be that in certain situations we need to consider whether or not it's more appropriate to take a free flow urine sample, which is completely non-invasive, and get some information from that before we go on to the more invasive sampling techniques. So again, that decision will be a vet discussion, but we will be very much involved in that decision-making process and in the collection process with that as well. Now we will need to make sure that we have the appropriate equipment for all the different sampling techniques, and I will go through the different equipment or some of the examples, and there is a huge variety of equipment available, and even for each method or each type of sampling that you might see, the equipment available at each practice will also vary significantly. So what you see in one practice might be different in another practice, and that is something that you will just need to get used to. But the general procedure, the general running of it, that will all remain the same as a whole, with some little changes depending on that practice. We also need to make sure that we are following all the health and safety requirements. Now later on, when we do go into the labs, we will do some health and safety prep with you, because that is a very important aspect of working in a lab environment. But for all of the different sampling strategies, there are health and safety risks, whether that is accidentally stabbing yourself with a needle in a blood sample, or a zoonotic risk from a contaminated sample. So there are risks there, and so we need to make sure that as veterinary nurses we are handling the equipment appropriately, that we are handling them in a safe way, and that we, where appropriate, are wearing personal protective equipment in order to avoid any unnecessary risks. Now again, the sampling techniques available will vary, and you'll see all sorts of different things. You know, if you just Google blood samples, you'll see, or if you look on YouTube, for example, you'll see a huge range of different sampling techniques out there. Some better than others. So I just want to say at this point, do be careful with what you see out there with different methods. There are some that are not advised. Okay, I will be discussing, and we will throughout the course be discussing the best practice. Okay, the gold standard way of sampling. You may see other methods, you may hear of other methods. Just bear in mind that they're not necessarily always advised. So we just need to make sure that at the end of the day, we are our first and foremost focus is the well-being of the patient, our own health and safety, and obtaining a sample that is of diagnostic quality. So it is going to be good enough in order to run the required tests. Throughout all of this, we need to make sure that the sample contains has the correct patient identification on it. So labeling the sample, whether it's a blood tube, a blood slide, or a universal container, we need to make sure that the patient details, also the owner details, and the date is on there, so that there is no mix up with any of these samples that are obtained. And then we need to make sure that they are stored correctly. If we are going to be running them as an in-house test, then you can run it immediately. The sooner you run it, the better. If it is going to be sent to an external laboratory for testing, then that is something that we will be covering later on in the course, because it is one of the learning outcomes, and so we can make sure that we store it and package it appropriately in order to be sent to an external lab and still again be of diagnostic quality. So that is the main thing. We need to make sure that we have that diagnostic. Now, equipment. And equipment is something that, again, as I said, there is a huge range of equipment available out there, and that will really vary depending on that practice. So, for example, on the top, you might see that you've got this refractometer. That is, again, a common piece of equipment that you'll be using in practice, but when you're looking into a refractometer, you'll see different scales, and that scale will vary. So you need to be confident in using the equipment and identifying the scale that you need in order to use the correct or get the correct results for the vet. You'll see there's microscopes there, there's centrifuges, there's a huge range of equipment that you'll be using in the labs here. that most veterinary practice will, I should say all veterinary practices that you're going into for your training, because it's a training practice requirement, will have access to. But again, the finer details on the use of these will vary. So we will be using the labs here in order to prepare you, but again, just bear that in mind. Now, I'll be going through the different sampling or equipment for each one of these individually, but one thing I will just mention is that a lot of the commercial equipment, such as blood containers that you can see on the bottom left of the page, there are various different varieties depending on the type of containers that you will be using, and you will need to know the main differences there in which one is the most appropriate to use. I'll be going through the sort of the gold standard. Again, just to reiterate, you may well see some variety or variances depending on what that practice will use, but we'll be going through all sorts from, as I said, blood sampling to skin scrapings, fecal analysis and bacteriology as we go, and you'll be doing the actual practicals in the lab setting. Now, the blood samples, the main equipment that you're going to need is a syringe and needle, which obviously sounds obvious. So it sounds obvious, but the main thing is that the syringe and needle need to be of the appropriate size. So the syringe should be the smallest possible size syringe. Generally that would be a 2 to 3 ml syringe ideally, and the needle will be the largest needle size possible to avoid cell rupture. The risk of using a smaller needle means that there's an increased risk of cell rupture, which can affect the results of a blood sample. So ideally in a dog and a cat, you're going to be using a 21 gauge needle, which is a green needle. If necessary, or if it's a smaller animal, you'll be using a 23 gauge needle, which is a blue needle. And for your small exotics, I should say, a 25 gauge or an orange needle may be used. But if you're for your routine cats and dogs, as I said, you want to use the largest possible needle that you can, and therefore it is a 21 gauge or green needle that is the most appropriate. You're then going to need to make sure you've got a skin preparation available and cotton wool or swabs. Now the skin preparation, we tend to use two different types. So the first one is or an example of one is chlorhexidine, which is a sort of a skin scrub solution, which can be made up, and you can use again cotton wool or swabs to clean the area initially once it has been clipped. So your next thing is going to be clippers or scissors. Some people might use scissors initially, but you want to make sure that you haven't got any hair getting in the way of that clean area. So clippers are probably the most appropriate for a blood sample. So you clip the area. You then use that initial skin scrub solution such as chlorhexidine, and once it's been cleaned with that chlorhexidine, you can use a surgical spirit again on a swab, or though some people do just pour it on, that you can use that on the area as the final skin preparation for that location of blood sampling. One thing to note with the spirit is that you need to make sure that you leave the time to dry, so it won't have had an effect until it has fully evaporated. So if you soak it, it will take longer. But the other thing is, if you soak it, especially if you're using it for smaller animals, so some of your exotics, your neonates perhaps, that will really cool the area. You don't want to get it as very wet, because it will mean that they might get a little bit cold. And the smaller animals do get cold much quicker, so avoiding too much use, so pouring on of spirit, and too much sort of over soaking of chlorhexidine is ideal. So you're using the swabs or cotton wool in order to apply it is most appropriate. You then need to be prepared and have a receptacle such as a blood tube, which you can see in the top right corner there, or a vacutainer. So the vacutainer you could see on the previous slide are blood tubes that are just a different sort of format of a blood tube. So they work on suction, whereas a blood tube has like a screw cap or a clip cap, which you remove in order to fill it fill it up. So the one that's in the top right corner here is a blood tube. And then you need some dry swabs in order to apply after you have taken the sample. So for post-venipuncture pressure, because you want to make sure it stops bleeding after you've taken that sample. So to put pressure on it using that swab, and of course gloves. So ideally, before you even start, you should have washed your hands, or cleaned your hands using the WHO hand hygiene cleaning method, and then applied the gloves, and then you've taken the sample. So this is all the basic equipment that you need in order to take a sample. Now the next thing really to think about is where are we going to take the sample from, and this will again really vary depending on the species. So a little table here, which is from the BSAVA Textbook of Veterinary Nursing 5th edition, and it just lists the appropriate veins for sampling. Now, if we look at jug and cat, for example, the cephalic veins are listed on there, which is the vein in the forelimb, which a lot of the videos on YouTube or the pictures that you see will be taking the blood sample from the cephalic. But the risk of doing that is really that you might cause a lot of bruising to the limb. It's hard to get the good enough flow of blood to get enough blood to then prevent clotting. So often you can't get a very large sample. So whilst it is possible to get a sample there from dogs and cats, it's probably your last choice, your third choice of blood vessel. If you have to use it, then fine, but there are more appropriate blood vessels. So the best blood vessel to, or the best vein, I should say, for obtaining a sample in dogs and cats is the jugular vein, because the pressure in that jugular vein will allow for a suitable volume of blood to be obtained for a sample for most routine blood tests. If you can't use the jugular, your second choice will generally be the lateral saphenous vein, which is on the side of the hind limb. In rabbits, again, we've got a similar listing, but the most commonly used blood vessel is the marginal ear vein, which is in the side of the ear. And again, in horses, you'll see that we will have the same jugular, lateral saphenous and cephalic, although you have got a couple of other ones, if absolutely necessary, that can be used. So the lateral thoracic and the transverse facial, but these are less commonly used again. Now in exotics, there are a number of locations that you can obtain them. So for example, in birds, and you can see here we've got in the picture in the PowerPoint, they're obtaining blood from the blood vessel in the wing. But again, the jugular is probably the most common, especially in your larger birds. It is a much more appropriate blood vessel to obtain a good enough volume of blood from. And in lizards and snakes, the ventral tail vein, okay, so as you can see in the snake here, is generally the most common one, although the others are available. And in the picture of the tortoise at the bottom, that is a jugular blood sample, although at the base of this. So once the blood sample has been obtained, we need to make sure that we prepare or contain it in an appropriate setting. So for example, it might be that we use a blood container, okay, which you can see in the top right corner here, or a vacutainer. So I mentioned it on the previous slide, and that will depend on what that practice uses. So the ones at the bottom right of the slide are the vacutainers, which work on suction, and the ones in the top are the containers with the screw-on or click-on lids. So the choice of container will really depend on the diagnostic test required. So for example, it might be that the container contains an anticoagulant. So an anticoagulant is a chemical that prevents clotting from happening. And there are a number of different ones that we might use. So ADT is one of the ones that we might use in order for, it's quite a common one actually, because it causes minimal changes to the actual morphology of the cell, so therefore it's quite useful to put it in an ADT tube and then undertake a blood smear or a cell count, because it doesn't really change the morphology of the cells too much. What it can't be used for, however, is for avian or reptile blood, okay, so we wouldn't use it in those situations. The fluoride or oxalate anticoagulant is generally used for glucose samples, so for tests for diabetes, perhaps. And the heparin is again a very, very common anticoagulant used for samples which are then taken for biochemistry, where we actually have to test the plasma rather than the blood itself. Or for example for hormone tests, perhaps, because the plasma is one of the components of blood. So all the blood cells, like the red blood cells, the white blood cells, actually sit in plasma, and sometimes we just want the plasma without the actual blood cells there, so it separates it without it forming actual clots. We don't want the clots to form, so the salts contained within the heparin prevent the clots from forming, but allow the plasma to separate from the rest of the blood, so from the actual red blood cells and white blood cells, so we can then just test things like hormones or other chemicals. So the other option is to not use an anticoagulant, and these are termed as serum samples. So serum is a clotted sample, so we then the sample will clot and separate in that way, and you're left then with a clear serum element, and then the remaining clot and blood cells are separate from that. And again, it will just depend on the type of sample that is needed and the type of test that is needed as to which one will actually be used. We can then use, or we can produce a blood smear from an EDTA sample, but we can also produce it directly from that syringe for blood sample. So you can see the picture in the middle here of a blood smear, one with a stain, which is the one on the very right, and one without a stain. So if you're taking a sample, producing a blood smear, and then sending it to an external lab, it's not necessarily going to have a blood stain already applied. If you're looking at it in-house to do cell counts, for example, differential cell counts, it would be stained, and therefore it's common practice to have a staining solution in practice as well. And then again, you might use packed cell volume, which is a common test, which you can see in the other picture here. And again, for this, you'll use a microhematocrit tube. Some of them will have an anticoagulant and some of them won't. So for example, if you're taking the packed cell volume microhematocrit tube blood straight from a syringe, then it's likely that you will use an anticoagulant so that the blood doesn't clot before it gets to the full level that you need to run the test. If you're taking or you're running a PCV test directly from an EDTA sample, so for example, an anticoagulant is already in that, then you will not use a microhematocrit tube with an anticoagulant in it because you already have one, so you'll use a plain tube in that situation. Once you've got the full sample in the microhematocrit tube, which is the one on the left, it will then be placed into a centrifuge, which will spin very, very fast, and it will separate the different components of the blood, which is the tube that you can see just on the right after centrifuge. So the darker bit at the bottom are the blood cells, and the clear bit at the top is the plasma, so the clear part of the blood. Now, as I said, there are a number of different tubes depending on whether they're vacutainer or sort of normal tubes, and the colour of these varies, and that's where it gets a little bit confusing. So most practices will generally use a normal tube, but that's not to say that they don't use a vacutainer, so it's just to be aware of the different colours for each of those. For example, lithium heparin, which you can see in the top, is an example of the orange tubes containing lithium heparin anticoagulant, which might be used for biochemistry. But in the vacutainer version, which is on the bottom picture, it's a green one. So the tube colours will vary, so just be aware of that. Again, with the EDTA, it's the pink tube that you want at the top. Okay, so the top picture, the pink tube is the EDTA, but in the bottom picture, it's the purple tube, and those are run for hematology. So looking at the red blood cells, the white blood cells, and so on, the actual blood component of that blood sample will be using EDTA. The fluoride oxalate in the small tubes at the top is yellow, and the one at the bottom, it's the grey one. For the sodium lithium citrate, this luckily is the same across the board, so it's blue for both of them, and that is for when you're testing things like clotting times, so actual testing for coagulation of a blood sample. So if how long it takes for that blood sample to clot. So if you have a disease or a poisoning, for example, that might prevent that from happening, you might use those tests in order to monitor clotting times. Finally, if you're using a serum one, okay, so the bottom one, where you have no anticoagulant in it at all because you want it to clot, it can either be a plain tube or a brown tube. So in the top picture at the very back, so next to the green one is the brown tube, or the plain tube is the one on the left, which is clear with a black line on the top. That is a plain tube as well, so they're just white. But in the Vacutainer collection pots, that's the red one. Okay, so that will vary, and that is just one of those things that you just have to bear in mind. Okay, so moving on to urine samples. Urine samples are great because they are non-invasive. Or they can be non-invasive. They're not always non-invasive. They can be non-invasive, and therefore it's something that's quite easy to undertake. People can undertake at home and bring a sample in, and as vet nurses, we can do that as well. They're simple and quick to run. They're cheap to run as well, which also helps. And it's just worth bearing in mind that dogs, cats and horses will produce about 1 to 2 ml per kilo per hour of urine. So we can monitor that by collecting the samples if necessary. Now, if we are going to be taking a sample to run, ideally we want to make sure that it is a morning sample, so the first sample of the day, first thing in the morning, and that really helps us to identify the concentration of the urine and to ensure that the kidneys are able to concentrate it. So therefore, it would be the first sample of the day. Ideally, if you are taking a sample, you want to then examine it within 1 hour, because we then start to see some changes to that urine after that time, which can mean that we get inaccurate results. So the number of ways that we can get the samples, so there's free flow, manual expression, catheterization, and cystocentesis. So with the free flow samples, it is just a midstream collection in a bowl as the dog or cat is or horse is mid sample or mid urination. So this is something that the owners can do at home. There are commercial test kits with sort of funnels available, and for cats as well, it can be that the owners use a non-absorbable litter. In practice, we might use that as well if we have a cat that's long time hospitalized in order to collect those samples. So we can use non-absorbent litter, which we can then transfer into a universal container. Now this is a non-sterile method, so it's not suitable for microbial testing, so looking at the bacteria in a urine sample, for example, because that can have some environmental contamination. The manual expression, which you can see at the picture at the top of the slide, is relatively easy in dogs, cats and small mammals, but we do have to be very, very careful with this technique because there is a risk of bladder rupture or trauma to the bladder if we push too hard. Again, this method is non-sterile, so not suitable for microbial tests which look at the bacteria. We then got a catheterization. So the picture in the middle, which is of an X-ray, you can actually see the catheter in place going into the bladder. Now this is, if it's not blocked, if the bladder is not blocked, which is a relatively common issue in cats, if the bladder is not blocked, then it's relatively easy, but we do tend to need some form of sedation or general anesthetic in order to place it without causing too much discomfort. Now this is a sterile sample, but again there's always a risk of trauma or infection, so we do have to monitor the patient carefully, and the catheter can actually be left in place long term, which is very, very useful for a blocked bladder cat because we want to make sure that they have this free flow. We don't want the bladder to fill up and fill up and fill up and without being able to empty. So with a blocked bladder cat, it might be that urinary catheter is left in place. We can then collect the samples regularly and continue to monitor them. The bottom picture is of a cystocentesis, which is where a needle is passed in a sterile manner into the bladder via the abdominal wall. For this, because it is going into the abdominal cavity, we need strict asepsis, so we need to make sure that we are maintaining asepsis. And ideally, in order to cause as little discomfort as possible, it needs to be quick, sterile, and sometimes we might still need to have some sedation or general anesthetic. Because the needle is going through the abdominal wall, there may be some blood contamination in the urine. So running a urine dipstick, for example, may pick up on more blood than is actually in the urine, and that is just from that insertion of that needle in. So fecal samples are used really for the diagnosis of endoparasites, viral diseases and gastrointestinal diseases. So there's a number of reasons why we might do or take a fecal sample, and different ways that we can run it. Now, when collecting a fecal sample, we need to make sure that we follow strict hygiene protocols to avoid contamination of ourselves, and this is where we have a slight risk of zoonotic diseases. Now, again, if we are taking a fecal sample and the animal has been on treatment for something, for example, it might be that they've been on antibiotics for some kind of gastrointestinal disease, then it might be that the medication needs to be withdrawn for a few days before we take a fecal sample, because it can provide incorrect or false results, so false negatives, for example. The sample itself can be taken directly from the rectum. When doing this, you use gloves, of course. You take the sample directly from the rectum and then hold the feces, turn the glove inside out with the feces within it, tie it all up, and that is a storage method for that fecal sample. We can label the glove, or we can transfer it into a universal container. So this container that you can see in the picture here is a universal container with a little spoon. Now, direct rectal fecal sampling is very useful if you have animals that are housed in groups, so that you know exactly which animal that is from, okay? Because if you've got, for example, a horse in a field with multiple horses in it, you don't necessarily know which one it is that has passed the feces. So if we need to make sure that we know who it's from, then this is one of the methods we can use. Alternatively, we can take a sample from the environment, so that is, as I said, just taking it from wherever it has been found and then transferred into a container with a spatula, which is what you can see in the picture there. Now, again, ideally we want to make sure that we examine it within a few hours. If there's a reason that we can't do that, then it can be refrigerated and then tested at a later date. The parasites that may be within the fecal matter. Now, skin and hair sampling is really to look for things like ectoparasites, so ringworm, lice or mites, which may be on the skin. But again, here we need to take care that we are thinking about our own health and safety. So these can be zoonotics, they can transfer to humans, so wearing appropriate personal protective equipment is essential. So one of the methods that we might use are skin scrapes, which you can see in the top slide, which uses a blade to scrape away the top layer of the epidermis, so the top layer of the skin, and then to apply it onto a slide with some liquid paraffin to look at it under a microscope. Some mites live just below the surface of the skin, and so in order to then be able to diagnose them and identify those mites, we need to just scrape away that top layer. So you're not cutting into the skin, you're just scraping away a little bit. So mites such as Sarcoptes scabiei are one of the mites that might be found in this way. We can then do adhesive tape impressions. It is as simple as taking a bit of tape, applying it to the skin and then sticking it to a slide. So superficial parasites such as Clientiella, which is also known as walking dandruff, can be found in this way, or bacteria, fungi, yeasts may be identified by taking an impression with some sellotape. So really nice and simple. Hair plucks does what it says on the tin. We take a small sample of hair using artery forceps and remove them, place them onto a glass slide with a bit of liquid paraffin and look at them under the microscope. So these, again, fungal spores, superficial mites, or mites that sort of are attached to hairs such as Demodex, or some of the parasitic eggs which attach to hairs can be found in this way. Hair brushings are very useful as well for superficial parasites and eggs, so or also things like flea dirt. So by combing the skin onto some white paper or some white tissue, we can then identify whether there's anything present. To make sure if it is just flea dirt, you can wet it, and if it then comes away red, it is digested blood, so therefore it is flea dirt. Otherwise, we can then transfer it again onto a slide with a cover slip and look at it under the microscope. An impression smear is just placing a slide directly onto a skin lesion, for example, and this again can detect bacteria, fungi or yeast conditions. So we would probably want to clip the skin first and then push the slide onto the skin and then look at it under a microscope. Finally, swabs. Swabs are really useful for bacterial, fungal and yeast conditions. So the swab is just rolled over the affected area. So it might be in the skin or it might be in the ear canal, for example. It's then placed into the container and then sent off to an external lab, or it can be then placed directly onto an agar plate, for example. Which is very, very similar to environmental monitoring, which we'll come on to next. And then we can look to see what grows on those swabs. Generally, these are sent to an external lab, but it is just... So the environmental samples are really to monitor, or really important to monitor, both husbandry and cleaning protocols. And this really is because to make sure, as we said at the beginning, that our cleaning protocols and our husbandry procedures are appropriate, that we are maintaining correct levels of hygiene, that we are we haven't got any areas where we might have more bacteria, for example, forming, which can then be detrimental to an animal that is already immunocompromised, for example, and is hospitalized with you. So we would swab the required area, and this is something that we will be doing in the labs later on in the year. We then apply it to a required plate, and then we will make sure that the appropriate environment is provided. So this might be if we're looking for specific types of bacteria, that there's humidity, that there's various nutrients available in that agar plate, for example, the pH is appropriate, the temperature is appropriate. So for example, most bacteria will thrive between 37 and 40 degrees Celsius, or if it's the correct gaseous environment, so whether or not it's anaerobic or an aerobic bacteria. So we can provide these different environments in a sort of a synthetic setting, in a lab setting, and then see what grows, examine the plates. We may or may not stain them, and that will then help us to narrow down the types of bacteria that we might be dealing with. Generally, for environmental sampling, we'll start off with a nutrient agar, which is a very sort of general plate, and then we can differentiate and select different types of media to narrow down the spectrum of bacteria that we might be dealing with. So this is all stuff that we will be... So just to summarise, there are a variety of sampling techniques available in the veterinary practice, and that really are sort of the things that you'll be doing. The procedures will be the same in terms of how we obtain a blood sample, but some of the equipment surrounding that will really vary depending on the practice that you will be doing your placements in. Whatever way that you see it being done, it is an essential part of diagnosing a condition for vets. So it's really important that we as veterinary nurses are able to obtain a blood sample, that we can handle them correctly, that we can run some of these tests appropriately. The actual sample that we take will depend on which test is required, and because of that we will be running a variety of tests in the lab sessions when you get to that point. So for example, we'll be doing the environmental analysis, blood, urine, feces, and a few other little bits and pieces later on in the year as well. So thank you very much for your time. I will see you all in a few weeks' time, and until then, if you do have any questions, just get in touch. Thank you.